Hi guys, welcome to my new video. It's been a long time since I made one, so it's time to my health update. Before I get started, disclaimer time as always. If you find any of my health advice interesting or helpful, please discuss your situation with your doctor before you take any medications and make your own decisions. Because what works for me might not work for you, we are all different. I have to rely on my own research to treat myself, not because it's fun or because it's the right thing to do, but because it's my only option for now. So now we're done with that. I'm very happy to say that when it comes to my health, I made a big progress in comparison to how I was back then. First of all, so during this time I came to realization that I probably was misdiagnosed. My doctors diagnosed me with a relapse of depression, which now I think that probably is chronic fatigue syndrome and not depression. And also I find some new medications that really helped me, and I'm going to get into all of that in this video. But before I do, I want to briefly go through everything that happened to me for for some people who are new here. When I was a teenager, I went through a pretty severe depression. I recovered from it using natural treatments only. If you want to know more about that part of my life, I'm going to put a link in the description to the video where I talked about that. And after that, I felt completely healthy for about 3 years. And then I went through a very severe respiratory infection. And after I recovered from that infection, I started experiencing fatigue, I experienced anhedonia, and I experienced certain level of exercise intolerance. And these are the problems that are still with me to some degree right now. So my doctors diagnosed me with the relapse of depression, and I gotta say that I think that it's not depression, I think it's chronic fatigue syndrome. So now I'm going to talk a little bit about why I think I have chronic fatigue syndrome rather than depression, because I think that this is a very important topic. Because these illnesses are not the same. They are different and they should be treated differently. So let's get into it. First reason why I think that I have chronic fatigue syndrome rather than depression is exercise intolerance. There have been many studies done for depressed people, and these studies show that exercise in majority of times helps with depression, or at least doesn't make it worse. But with chronic fatigue syndrome, it's different. For patients with chronic fatigue syndrome, exercise very often makes them worse. People who have chronic fatigue syndrome know that sometimes you can go and exercise and after that you're gonna have a crash. You're gonna feel so much worse for days or weeks or sometimes for even months. So my exercise intolerance is the first reason why I think I have chronic fatigue syndrome. Second reason why I think I have chronic fatigue syndrome rather than depression is that I don't have mood problems. My mood is stable, it's either normal or a little bit lower than normal. Overall, my mood has been fine for years and years and years. Third reason why I think I have chronic fatigue syndrome is because of how it all started. Depression typically starts with a stressful or traumatic situation, or it may start out of nowhere. It may start because you're simply genetically predisposed to it. But chronic fatigue syndrome typically starts with an infection. In my case, my problem started with an infection. And the last reason why I think I was misdiagnosed is because I respond well to antiviral treatment. I found a study that researched the effects of antivirals on people with chronic fatigue syndrome, and I'm gonna put a link to this study in the description below. In this study, it was found that antiviral drug named valacyclovir can be helpful for people with chronic fatigue syndrome, and I tried that drug and I responded really well to it. Depression typically is not treated with antivirals. For people with chronic fatigue syndrome, antivirals sometimes help, and in my case, they were so helpful. So after I started taking valacyclovir, my problems with fatigue improved drastically. Like, so right now, sometimes I can go for several days without any fatigue at all. And a year ago, 2 years ago, that was unthinkable for me. And right now, on a lot of days, I don't experience fatigue. I just can go about my day and doing one thing after the other without this constant heaviness in my brain and in my body, and it's amazing. My exercise intolerance also improved a lot. Right now I can do 30 minutes of yoga with no problem. I can go on a 15-minute run with no problem. Again, huge improvement in comparison to what was happening to me like a couple of years ago. Anhedonia, unfortunately, to some degree is still with me, but there are improvements in that department also. So other than valacyclovir, I still take fluvoxamine, and it has been quite helpful. I'm still on that medication. I also take omega-3 fatty acids. I eat healthy. I increase my levels of activity gradually, and all of these things have been working. Slowly but steadily, I'm improving, and someday I really hope that I will get to a full recovery. Some people in my life say that it's been going on for so long, you should just accept your current situation and adapt it, and I refuse to accept it. I hope that I will recover fully sometime. Anyway, I hope that my video made sense. I hope that it was helpful to you in some way. See you next time in another video.